So we're going to stay on our back here, and now I want you to get your feet up on a wall. So obviously on a wall here, I'm using the bench, so I'm pushing my heels into the top of the bench to get the correct angle. So from the side view, just kind of look like this. Like this. Here, about 90 degrees at the hips, about 90 degrees at the knees here. And then from here, we're going to be slowly scraping across the wall into your max internal rotation and holding there. So here's the back view here. Also there's a block here between my knees here. If you yoga block, it's great. Or you need a small ball that has some give in it, where you can push into it. It's not going to pop, or it's not going to be solid. Anything of this or that nature, and anything between, is great to have between your knees for this exercise. So it's again, here, kind of slowly going into internal rotation. Going to end range there, and then you're just going to hold there. Right? This is a very light and low intensity stretch, just exposing our hips to the internal rotation motion and position, and it's kind of breathing through here. So it's a great exercise for somebody who has very limited hip internal rotation. So you're somebody who has like 5 degrees or less than that, this is a great one to get you used to positioning. Another thing here is that when you go to your end range, you feel a pinch in the front or kind of in the middle of your hip and groin area. Reduce the range of motion till you don't feel a pinch there anymore, and just kind of hang out there. And third thing, I don't usually advocate for this because we're in a very low intensity and safe position, you can try to get a posterior tilt of your pelvis. So think about trying to slowly push your lower back into the floor. This is not an aggressive push like you're doing an ab exercise. This is more of like just kind of tilt the pelvis a bit, just gently touch down there, and that'll open up the hip internal rotation a little bit more too, right? And I don't like to rely on that posterior tilt to get more IR, but it's a very safe and low risk position. We're not really training it heavily here, so I don't mind, especially if you're someone that's limited IR, that can really help you get into position, get comfortable there. So I'm just gonna breathe here. Just nice controlled inhales and exhales. Just getting used to being in this position, and then we're gonna do some light contractions after that minute or so. So keep holding here. Got just the timer. There you go. So staying where you are. That max end range internal rotation. And just breathing, trying to fill that belly up. We got 360-degree fashion, and then trying to get all the air out. And every 2 or 3 exhales, see if you can get a little bit more internal rotation here too. So this is actually really opening up my hips here already. This is nice. This is nice. This is a good idea. Keep breathing. Another thing, as you increase your internal rotation on the wall, if you do, I want you to scoot your hips closer to the wall. Because as you do that, I don't want your hip angle of hip flexion to decrease. So earlier I was in about 90 degrees. I was about this plane here. Now it's kind of gotten less. So I'm going to scoot a bit more forward, just so I can get back in that plane of motion. Ooh, this is good. And make sure that your pelvis is not hiking one way or the other as we're here. Make sure it stays kind of neutral at the hip here as well. Okay, so now we're gonna do some light contractions here. So now I wanted you to first think about you're trying to do external rotation of your hip. We're doing about 10 to 30% of your max intent here. So how to do that? I want you to think about trying to squeeze your knees and thighs together slightly, and as if you're trying to do this motion here where you're bringing your foot across and towards the middle. I'm moving just to show you the direction of the contraction. Do not move. I want you to have that contractional intent in this static end range of internal rotation. So holding 10-30% of your max intent is holding there. Like I said, we're keeping this pretty light. We're not going too intense here. Just trying to get our hips warmed up and see if we can get more range in the beginning class here before we train it more. as you kind of increase the duration of the contraction, maybe even the intensity, you can feel kind of your inner groin, maybe even near your glute area start to kind of turn on a bit as well. That's totally normal, and that's actually what is expected. So it's, again, we're contracting towards the middle with our thighs and knees, and contracting as if trying to get our feet to clap and slide across the wall. And relax the contraction, and see if you get a little bit deeper each side. Or if you do get deeper, scoot your butt closer to the wall to stay in that 90 degrees of hip flexion here. So I don't know if you notice on yourself as well, but on me, I've gotten like probably twice the amount of range of motion just sitting here and breathing through it. And part of that, my muscles didn't get longer, right? My nervous system just really down-regulated and relaxed, and allowed me to get into the position through the breathing, through the slight stretching, and through the contraction we just did. So combination all those different things are great ways to really expand your flexibility rapidly in a short amount of time. And let's go one more contraction here. Think knees together, slight tension. And then from there, think feet together, slight tension. And just holding that isometric contraction as if you're trying to externally rotate your hips together. Another cue, think about your femur is trying to rotate externally, so kind of rotate this way. And that will help you get that contraction right as well. So try to not going more this way, they're trying to contract and really rotate towards the outside and behind our thigh. And once again, this contraction is not very intense, it's just 10 to 30% of your best effort. I'm going to hold here for another 15-30 seconds. Okay, really control your breathing too, not shallow breathing right now, just nice deep breaths as we're doing this light intensity contraction. 5, 4, 3, 2, 1. Relax the contraction. And one last time, see if you get a little bit deeper at both sides. Try to keep your hips somewhat even as much as you can. Hold that last stretch there for the 15-30. We're just breathing through it. It's okay if you're posterior tilt or if your lower back is touching the ground. It's fine for this exercise. But when we do the next one, where we're doing actual lift-offs, when we're training this position, I want you to make sure that we're really honest through our pelvis and through our entire spine. And I'll get through that in the next clip. And relax here.